7:23, coming around towards 7:24 in Trinidad and Tobago. Well, because of COVID-19, just about everything is going digital these days, with especially the relatively new concept of telemedicine has found its way onto the shores of Trinidad and Tobago. Obviously, these services and these things online are going to happen more and more. It has assisted with healthcare accessibility, especially with this COVID-19 pandemic. Insurance giant Sagicor has announced that they will be accepting these claims, and we're joined now to give us some context to this by Robert Trestrail, Executive Vice President and General Manager of Sagicor Life, and Dr. Alexandra Ames of Ames Medical Services, a general practitioner who works in the communities as well, will be giving us a perspective. But let's bring Robert into the discussion. The reason I'm using the name Robert is because I have the privilege of one of the very few wickets that I would have taken in cricket at a club level or at a school level would include Robert. So I got a big puppy in those some 30-something years ago. Robert, good to see you once again. Thanks for joining us.
Hi, Fazir. Good morning, and what a way to welcome you. Good morning to Trinidad and Tobago.
Yeah, well, I always try to come up with a unique introduction. I don't think you ever got an intro like that. Tell us how this telemedicine thing works and what Sagicor is doing to facilitate it here in Trinidad and Tobago.
Well, Fazir, I'll defer to Dr. Ames on how it works, but from a Sagicor perspective, we had the issue of telemedicine. We've been reviewing it for many years. It's not a new factor in the field of medical service providers. It's been something that you've seen on the international market for many a year. And in fact, when Dr. Ames speaks, she's a great advocate for this and really a pioneer in Trinidad. And she's been promoting this type of engagement for the past, I would say, 2 or 3 years. What's new is that we were scheduled to adopt this, I would say, more in the month of July. But with the I suppose, the introduction of the virus into our environment, when we saw the developments taking place in Wuhan early on in the year, this is one of our features initiatives that we decided to aggressively accelerate. And what really it is, as I said, telemedicine in itself is not new, but what it is really the adoption by Sagicor to recognize that this is a legitimate form of treatment for patients that help them manage their healthcare in remote circumstances, and we will be honoring all claims provided through telemedicine. Just from a context, as you described us as a giant, and we're the largest insurance company in English-speaking Caribbean. And the truth is that we operate in 20 jurisdictions. And while in Trinidad we may not have had the issues of curfews and full lockdowns, in many of our other territories, we have experienced clients having to exist in a 24-hour curfew and a 24-hour lockdown. So this initiative really allows us to have our clients connect with service providers to be able to help them get the necessary treatment in a very difficult time.
Indeed.
Times where there are psychological pressures and they need to get some help in terms of how to treat with their circumstances.
Absolutely. So let's get Dr. Ames into the discussion. Doctor, thanks very much for making yourself available to speak to us this morning. Tell us a bit about telemedicine and how it works.
So telemedicine is just a way for a doctor and a patient to communicate or exchange information or to really have a consultation when they're not in the same place. So in its simplest form, that might be a telephone call, but in its more modern form, one of the techniques that I use is a medical video consultation. Really, I started this 3 years ago to solve the traffic problem. So my practice is in Woodbrook, and what I was finding was that after the lunchtime rush when schools were out, people were finding it harder and harder to get to their appointments on time. So I started to offer this to my existing patients for minor illnesses like red eye, cough and colds, uncomplicated urine infections, or maybe just follow-up of their chronic disease like their hypertension or their diabetes. So that's why I started it. But in its simplest form, that's what it is.
How effective is telemedicine, doctor? Because sometimes I'm trying to imagine issues where people not explaining themselves properly, or sometimes some people say, well, when they go to the doctor, sometimes the doctor just sign a prescription and hand them to go and get treatment. From your perspective, how effective is telemedicine?
Well, actually, I think it's very effective. I think communication is extremely important, and this is just another way of communicating. And, we're taught in medical school that 80% of the diagnosis is the history. So no, I'm never one of those doctors that will just sit down there and sign a prescription. I believe in listening to my patient, and part of being able to listen is being able to increase access, and I think that's what this does. So I think it's very effective. In terms of how many, so what I do is I back my video consultations up with the fact that if in the course of the consultation, either the patient or I realize that actually this is much more complicated than we initially thought, and I actually have to physically lay hands on the patient, then I will bring the patient down at no extra cost to do that. And in terms of effectiveness, I think one of the things I measure is how often I have to do that. So how often do I actually have to convert to an in-house consultation? And I would say 5 to 10% of the time. But part of that is because I educate my patients about what might be appropriate for telehealth. So I'm not expecting somebody to think that they can talk to me about their heart attack or their stroke via telehealth. Clearly not. They need to be in an emergency room. But just like whenever anybody gets sick, they have to make a sort of a common sense decision about whether that they need to go to the emergency room or whether they need to see their GP. They make a common sense decision about whether that can be done on telehealth. And I also have a useful video that I've uploaded onto the Ames Medical YouTube page and also onto the Ames Medical Services website, dealing with the kinds of things that are appropriate. And clearly what wouldn't be appropriate is an absolute emergency or something like terrible abdominal pain where somebody thinks they have an appendicitis, and clearly I'm going to have to palpate or feel their abdomen or tummies. So I think by making the right selection about which patient is appropriate and by educating them, and Victoria, my receptionist, is very, very good about talking through the process with them, then they are pre-selected almost, and very few of them end up needing to be brought down, right away.
Absolutely. So it sounds very effective as far as being able to get that communication and indeed saving time and effort as well in getting it done. Let's bring Robert Trestrail back into the discussion, Robert. As far as the process of those claims and so on related to telemedicine from Sagicor's perspective, how does it work?
Well, just to articulate one and build on something that Dr. Ames mentioned, Fazir. This is a pilot project that we've introduced for 3 months, so we can appreciate the use and how it operates. We do have selected services that are available, and as Dr. Ames says, this will not be something that will be recommended for emergency care. So this is really directed at things like, as a general practitioner will do, engage for possibly a cold, red eye type experiences, physiotherapy services, speech therapy, psychologists and psychiatrist services. So the offering is really designed to help us build our experiences in this world of tech and support our clients in these difficult times of COVID. With regard to your question of how a claim is submitted, I think it follows a very similar track to an existing traditional paper claim. We have provided Dr. Ames and the pool of 10 medical practitioner services that have joined us in this pilot with a fillable claim form, which basically mirrors very closely the paper-based form. So once the doctor is complete the examination, they will complete that fillable form almost as if you're filling out a form online for any other service. They will then share that with the client, who will then print it and sign it and email it to us along with their receipt. Now, the reality is some of our clients may not have access to printers, or they may not have access to a scanner. So what we will accept, and good faith, we will process the claim that has been a form completed by the doctor once it is accompanied by the receipt, and it is emailed to us from our client. So we accept that some clients don't have all of the technology available at their homes. So we're willing to work with them to ensure that they can get the service. And most importantly, we can help them manage their cash flows by paying for those claims promptly.
And before we get a final perspective from Dr. Ames on this being almost the future, this issue of telemedicine, Robert Trestrail, and you mentioned about, having all the technology. Sometimes if you're a dinosaur like me, you have the technology, but you don't know how to make it work. Does that present an obstacle in moving forward? If we're talking about the future of the insurance industry and moving online with all the tools that are required, do you see obstacles in the way with people not being able to get up to speed with all the technology?
Well, Fazir, I mean, I've served many a time on many a committee, and as you know, I've been past president of the chamber. And one of the things that we need to do in Trinidad and Tobago is to improve the ease of doing business. And one of the aspects that need to be focused on is just that. In these times, we need to accept that e-commerce, electronic commerce, needs to become more of the infrastructure built into our country's way of doing business. And that would include having to revisit and establish all of the legislative frameworks to ensure that that type of e-commerce can happen in all aspects, not just insurance, but in all aspects of our day-to-day lives. And I know Dr. Ames has a particular perspective in one particular legislation that should be reviewed, and I'll ask Dr. Ames just to comment on that.
Sure, Dr. Ames, as a final perspective, if you'd like to highlight that piece of legislation that you're particularly interested in.
Yes, I mean, I think the Pharmacy Act really needs to be reviewed, because I would really like it to allow for e-prescriptions, which is something that's very, very common in the rest of the world. And at the moment, during the pandemic, the pharmacists are being quite good about accepting an encrypted email prescription, and I will then afterwards get the original to them. But the fact is, the pharmacy law does require the original prescription with a signature on it. And that does provide a little stumbling block. At the moment, I think they are quite rightly trying to facilitate that, because at the end of the day, we don't want to deny patients access to their prescription drugs in a pandemic when we're on lockdown and we're trying to socially distance. So I think it's good of them to do so, but I do think the Act needs to be reviewed, and I'm very, very hoping that the Minister of Health and the Attorney General and the Chief Pharmacist will look at this again, because I think that if people could find a secure way of doing e-prescriptions, which I know is possible because it's done all over the world, well, not all over the world, but in Europe, North America and Great Britain, then I think that would really facilitate telemedicine. And in terms of your question about telemedicine being the future, I don't think telemedicine will ever completely replace a face-to-face consultation with a doctor, that relationship that you develop. I think it will just augment it and provide a convenient way, and perhaps in some cases of infectious disease like COVID-19, a safe way for doctors and patients to communicate and to exchange information, facilitate questions about medication, etc. And while I don't think, as I said, it will ever completely replace that relationship, I can see in the future maybe 25 to 50%, and that's obviously a guess, I don't have a crystal ball, of consultations being done via telehealth in the future. So having a Pharmacy Act that facilitates this and is up to date with current, technology, I think is very, very important.
Dr. Alexandra Ames and Robert Trestrail, thanks very much for taking the time to be with us this morning to offer some perspectives. And indeed, you can contact Sagicor for more information as to the available healthcare providers, how you can use those telemedicine services, and you can get further information as to how this is now making it much more convenient and accessible for you to utilize these services and indeed have it covered by Sagicor as well. 7:37 in Trinidad and Tobago. As we go to the break, we have another Ames